Hi ladies, Dr. Chris here with another part of the Women's Health series. Today I thought I'd talk about PMS. What is it? What to do about it? For some women, PMS or PMT, premenstrual syndrome or premenstrual tension, is a real issue. It's that week before or 2 weeks before your period for some women where you become moody and irritable, frustrated, easily angered or easily irritated. You feel like your mood is just low, that you can't seem to get motivated. You might feel tired, bloated, fluid tension. You might feel that your period's coming but it's just not there yet and you can't wait to get it. So all of those symptoms can cluster together to form a premenstrual tension syndrome or a PMS. That can be really debilitating for a lot of women, and it can be really worrying for some women. For some women, it might even border on dysphoric disorder, which we call it premenstrual dysphoric disorder, which is a real cluster of symptoms that can be so significant that you feel severely depressed, severely anxious. Some women become suicidal that week or 2 weeks before their period, which is obviously a very big problem. If you feel like hormones may be imbalanced and you're not really sure what to do about it, and you feel like you might have PMS, then the best thing to do is to have it looked into. You can have a blood test the week before your period, or a saliva test, which is often what I do to assess that further, and that gives us some information around your hormone balance. Some natural things that can really help are vitamin B6, evening primrose oil, either as a capsule or as an oil. It's much easier as a capsule. You can take that for the 2 weeks before your period. That can really help. Vitamin B6, at least 100 milligrams, or activated vitamin B6, which is called P5P, can really be helpful as well for some women. For some women, you can look a little bit further and take things like St. John's wort if you're not on the pill or you're not already on an antidepressant medication. And for other women, other strategies are needed, such as hormone therapies like the oral contraceptive pill or progesterone cream, which we sometimes use as well, which is body identical progesterone cream. Or for some women, they have to use antidepressants for that 2 weeks before their period to override that significant drop in happy hormone levels. So it's important to look at PMS. Don't just leave it. It can get worse as if we leave it and if it's ongoing. It's important to address some of those ups and downs symptoms so that they don't lead to worsening depression, anxiety. So if you've got any further questions around hormone balance and around hormone health, please feel free to ask them in the available spot below, and I look forward to answering them.